Hi, everyone. Thank you for listening to this talk. I'm Naveena, a PhD student at the University of Washington. I'll be presenting our paper on chat-based peer support for youth living with HIV. This paper was only possible due to the work and advice of collaborators from the University of Washington, Kenyatta National Hospital, and University of Wisconsin-Madison, co-authors David, Cyrus, Brandon, Megan, Grace, Irene, Richard, and Keshet. Our work is motivated by the importance of peer support and patient-provider communication for supporting people with chronic health conditions, especially in terms of mental well-being and doing difficult tasks like adhering to medication. To make this support more widely accessible, we explore how to leverage chat apps like WhatsApp, considering their uptake for many other social, political, and commercial purposes. In looking at the use of chat apps for facilitated peer support, we attend to the complexities of online participation in the context of stigmatized illness such as HIV, and the variable access to mobile phones and internet in many underserved settings. We thus ask the following in the context of a peer support intervention for youth living in an informal settlement in Nairobi, Kenya. What is the experience of the facilitator and youth in participating in chat-based facilitated peer support for youth living with HIV? What lessons might we take away for chat-based online health communities? To provide an overview of our study design and data collection, we conducted a 6-month pilot with 2 age groups facilitated by David, the second author. The pilot started with an intro meeting with youth to meet in person and develop privacy norms. It ended with a closing meeting to debrief and for youth to nominate a youth member and a health worker from a local clinic to take over facilitation. We analyzed chat records from both groups, notes from the meetings, and also post-pilot interviews with 20 youth and the facilitator. We saw a few themes around the youth's and facilitators' experience. One was the complex social dynamics of the group. The groups were diverse, with differing levels of closeness among members and differing opinions on sensitive topics and appropriate conversation. According to the facilitator, these differences were the hardest part to balance, and we describe how he worked to monitor and constructively moderate conversations. Another theme was diverse patterns of participation and how they shaped the experience of the intervention. We describe how factors such as intermittent access to the group, for example, due to being away at boarding school or not having mobile data at the time, contributed to the work of maintaining group cohesiveness, for example, effort from youth to catch up with missed content. We also discuss privacy. We describe the importance of the in-person meeting in building trust, allowing youth to be sure of the person you're chatting with, as one participant said. We also discuss how agreed upon norms such as using an app lock played out over time as youth became more comfortable with one another. Finally, we describe how the group facilitated informational and emotional support, which in turn encouraged youth to reclaim aspirations they had given up on. For example, participant 36 described how upon learning about discordant couples from the group, they felt they could have a partner or children. The reason aspirations are so key in our findings is that in youth's experience, aspirations and a steady source of support motivated them to do tasks like taking medication consistently. However, we also highlight the boundaries of aspirations as a guiding concept in design, particularly when focused on aligning with societal norms. Participant 37's quote about accepting and even reinforcing stigmatizing comments shows how a focus on norms could even feed stigma. We outline takeaways in 3 areas. One is the design of chat-based peer support and how it might support facilitators' evaluation of group dynamics and support participants in getting the most out of group content given intermittent participation. We also discuss privacy in mobile health applications, including the importance of establishing and revisiting privacy norms. We also discuss how, to support broader participation, we may need to go beyond norms to consider privacy in the design of the chat platform itself. Finally, in conversation with HCI for Development Scholarship on Aspirations in Design, we discuss aspirations in health and development. We describe how aspirations were successfully nurtured in this context through horizontal relationships, sustained support, and reflection and conversation around aspirations. We also discuss the limitations of aspirations when focused on the individual and how we might encourage reflection on aspirations for one's community as well. Thank you so much for listening, and I'm happy to take any questions.